Good morning, actually good evening, health assessment class. My daughter has nicely said that she would be willing to let me do an assessment on her so that you can see it, since we're not going to have class tomorrow. So we're going to start. I will upload all of these checklists as well, but I'm going to work off the checklist and talk you through it so you can see it. So what I recommend y'all doing is going ahead and practicing on somebody at home, your roommate, boyfriend, girlfriend, whoever you need to or have the ability to get some practice with these skills. Now, I know you don't have all the equipment. I don't have all the equipment here today either, but we're going to make this work as best we can, okay? This is what being a nurse is all about. Innovation. All right. So I'm going to start with my general survey. I'm going to look at the patient's physical appearance. I'm going to look at what I think their health might be, what their age, patient status, or hygiene. Concerning you working outside, you look good. Body structure. Oh yeah, I forgot mine isn't touchscreen. I'm going to look at her level of consciousness. She's looking at me, so I'm going to say that she's alert and awake. We'll talk about how to get some more of those questions in just a moment. What her behavior is. At least she's smiling at me today. What her mood. When we talk, we'll go through her speech. And also we'll look at her health literacy, okay? So what she knows about health, what she knows about her own health. We didn't watch her walk in, so we weren't able to look at her gait, but I know she walked over here just fine. Her posture is what I would expect, a little hunched over like everybody is. It's totally fine. I expect all of you all to be that way too. Mm-hmm.
And I'm over here straight as a line because I'm holding this.
My other daughter is videoing this for me. So,
hi!
And then she looks like she can move her head around really well, but we'll look at range of motion at a later date and time. So right now we're just doing her head. All right, so that's checklist number 1. All right, so I'm going to start. I'm going to start by inspecting and palpating her skin. I'm just doing what I can see. I don't need to do more than that right now. When you get to the different body systems, you can do the skin at those points in times. But I'm going to look for any cyanosis, any pallor, any jaundice, so you don't look like you have any of those things. I'm going to feel temperature. So what side do we use? The dorsal side of our hands. And palpate for temperature. What does that look for?
Don't worry about it.
Nice and warm. Her skin looks good and thick. It doesn't look overly thick. I don't see any buildup. I'm going to test her skin turgor. So I'm going to take her hand and I'm just going to pinch that skin up like we did in class the other day. I'm going to let it go. Make sure it goes flat. Make sure there's no tenting. Good job for being hydrated today. Yeah. Moisture. Her skin looks supple. So I'm not really worried about her problems there. I'm also looking for any nevi. I'm looking at her moles. I'm looking for any lesions, rashes, scars, tattoos, masses. If your patient has a tattoo, write it down to exactly where it is and what it is. Try to give exact information. You can even measure it out if you need to as well. If she had any piercings as well, I'd look at her piercings to make sure they look okay and not infected in any sort of way. Next, I'm going to be looking at the hair and the scalp. So I'm just going to look at the hair. You bend forward for me. Thank you. I'm going to look down. I'm going to move that hair and actually look at her scalp. See, I'm inspecting at this point. I'm just looking. Even though technically, yes, I am touching as well, I am just looking. I'm not trying to palpate for anything at this time. Assessing her hair color, nice and dark brown. Texture, nice. What?
I haven't washed my hair in a week.
Yeah, I know you haven't. Now I'm going to palpate her scalp for any pain or tenderness. Do you have any pain or tenderness?
No.
Okay. This is my favorite part of the health assessment because you get a good, nice head massage. And a good hair brushing. When your mom's doing it.
The wrong side. No, just continue.
I'm also going to be looking at her fingernails. It also on your checklist will say toenails, but we're just going to deal with our fingernails right now. So I'm going to look at her fingernails, look at the color, the markings. She bites her nails, so they are very short. They seem to all be well adhered to the base. Any
Nail
pain or
bed.
tenderness with that?
No.
What?
Nail bed.
Yes. Looking again like for her contour. Also gonna do capillary refill. So I'm gonna press down for about 5 seconds. Let it go. See if it comes back in less than 2. Okay? And that is all for skin and hair and nails. Alright, next. Alright, so when you look at these checklists, remember that if you've already like inspected and palpated her head, you don't have to go back and do it again, even if the checklists say to do it again, okay? So you'll see on your head, face, mouth, and neck checklist that you need to inspect and palpate the head. We've already done that. I'm not going to do it again, okay? Now I'm going to inspect the face. I'm going to look at her face. I'm going to look at symmetry. I don't see any real lesions or problems. Eyes look about level. Ears are level. She has an oval-shaped face. Nasolabial folds. Don't forget, those are from here to the edge of your lips. And then your palpable fissures are right in between your upper and lower eyelid. Assess her facial expressions. Can you smile for me? Very good. I don't see any involuntary movement. Condition texture of the skin looks good. I don't see any edema on her face. Can anybody tell me what I've forgotten to do? My other daughter is thinking really hard.
Oh, I would have gotten a C in this class.
So because it's me and I'm doing my daughter, I forgot to introduce myself and have them tell me something about themselves.
Oh, yeah.
So,
Oh, wow.
make sure I
How about
know.
hand washing, too? That might...
Well, yeah. And that in class we will do. But,
It also said put gloves
well,
on.
yes, I know, and it says to put gloves on, but this is my own child.
Oh.
So, so I would always come in and introduce myself. Hi, my name is Pam. I'll be your student nurse today. Can you tell me your name and date of birth?
Charlotte 7/25/12?
Yes.
Okay.
Can you tell me where you are?
My house.
Okay.
Where I reside.
Yep. Normally I would ask why they're here, but I roped her into this, so she's not going to answer that properly.
I volunteered.
I like the air quotes.
I volunteer as tribute.
Oh my God.
All right, so always remember that comes first. I was going to do a general survey and then introduce myself, and I plumb forgot. Because don't forget, your general survey doesn't have to be allowed. It is just speaking. All right, so now I'm going to palpate her face. Can you take your glasses off for me, please?
Yes.
Thank you.
Oh. I forgot what you looked like.
Wow.
Just the tips of your fingers all around. I'm going to go down her nose since I'm here. Any pain or tenderness in anything?
No.
I'm going to go ahead and do her ears as well, just because I like to get all the palpation out of the way.
Your hands are nice and warm.
Yeah, I don't doubt that. How her face feels good. If you can, so we're going to test for the temporum TMJ joint. Can you open and shut your mouth? Very good. There's no popping, there's no locking, there's no clicking that I feel when I do that.
I can do that.
What, pop?
Yeah.
Oh, I really do it well. You can also, if you want to, go ahead and test their temporal arteries. Do not. That's not helpful.
What'd you do?
She flexed her muscles.
Oh.
Flex my muscles.
Because you're so strong in your temporal.
Because now I'm going to inspect her nose. My students are going to love this video. I'm going to inspect her nose, looking at symmetry, looking to see if it's broken or not, any swelling, drainage, any problems.
No.
Awesome.
I mean, it's cold outside, but yeah.
I've already palpated her nose. There was no tenderness. All right, now I'm going to test for patency of her nose. All right, can you take one finger and put it on one side of your nostril and breathe in and out for me? Great. Can you do it with the other side? Awesome. If we were in class, I would tell you this is the snot booger time. So if you think you have boogers in your nose, please make sure you blow your nose before you try this. Because we're not trying to see how far they go.
How far I'll go. I'm sorry.
Next, we're going to test her sinuses. So I like to just use my thumbs. Why are you raising your eyebrows?
Because I'm scared.
I'm just going to press. Any pain or tenderness?
I mean, yeah, but I've always been congested.
Any pain or tenderness there?
No.
So just here?
Yeah.
Which side's worse?
I don't. They're about the same.
Okay.
Maybe
Okay. Cool. But just a little bit of firm pressure is all you need. I see a lot of students go like this. That doesn't do anything. They need a little bit of pressure, okay?
Let's give a facial.
Yeah. So now I'm going to look at her lips. What are you trying to figure
I'm
out?
trying to read the screen.
Oh.
You have to have
So this is an oto-ophthalmoscope. It has two different pieces. When you look at the mouth, go ahead and use the otoscope. Not a problem. So I'm just going to shine a light on her lips and look at them. I don't see any cracking. They look nice and moist. Let's see. What?
I just look stupid.
Can you open them so I can look at your teeth? All right. All her teeth look good. They might have a little yellow to them, but I expect that. So no problem there. Any dentures or missing teeth that you know of?
No.
Okay, cool.
I really would hope I knew if I had dentures.
I hope you would know.
Again, can you say open up your mouth? Wider, please. I'm gonna look at her buccal membranes on either side of her cheek. Okay, you can close your mouth. I'm looking at your mouth, so it'll be a minute. While I was in there too, I also looked at the roof of her mouth, which is her hard palate. We're not gonna worry about the stents and ducts. You guys are killing me.
Thanks.
You're the best video on YouTube. hands
Yeah,
down.
I know.
Show it to all my friends.
Now I'm gonna inspect her tongue. I am not, according to your checklist, we're supposed to palpate. I'm not going to do that, okay? And I don't expect you to is either.
Palpate the tongue?
Mm-hmm.
Why would you do that?
Because you can get masses on it.
Oh, yeah.
All right. Can you open up and stick out your tongue? There you go. Awesome. Tongue looks good. Can you take it to the roof of your mouth? What was that? That looks good as well.
Me trying to figure out what you were saying.
Oh. Floor of the mouth looks good. Her frenulum looks good. I don't have any concerns about her tongue. Now I'm going to look at her pharynx and her tonsils. You ready for this?
Uh-huh.
All right. I want you to say, open up and say, ah.
Ah.
So her tonsils are not enlarged in any way or form. The back of her throat looks good as well. There doesn't seem to be post-nasal drainage. Any sort of spots back there as well. This on your checklist will say that you need to use tongue depressor and gag reflex. We're not. No vomit. Okay? So then I'm going to go down and I'm going to look at her neck. I'm going to look for symmetry. It looks nice and supple. So you keep flexing your muscles. We're going to do a little bit of range of motion here. Can you put your chin to your chest? Okay. Can you put your head all the way back and look at the ceiling? Okay. Can you put one ear on one shoulder? Okay. What about the other side? Great. And then can you turn to either your left or your right? And then do that on the other side. Excellent.
The owl.
I'm going to palpate her trachea now. So just gently in the middle. Make sure it's midline. Feels nice and good. I don't see anything bulging. I don't see any weird stuff that's there.
Move your way, watch your eyes.
I'm also looking to see if I can see her thyroid. I cannot. So now, for the thyroid, you have two options. You have either posterior or anterior approach. I prefer posterior approach to testing a thyroid. So I'm going to stand up, if I can. I like to put my pinkies on their collarbone, roll my fingers up. So right about here, where these two fingers are, is where their thyroid should be. Okay? I'm going to... What are you doing?
I'm shooketh.
You're shooketh.
You
I don't feel anything. Can you take a swallow? Can you swallow for me? I don't feel anything. I don't feel any lumps or nodules. I don't see anything or feel anything that would be unexpected would. So that should be all of that. I'm going to double check before I tell you something different. Also on your checklist, it'll say to auscultate it. We're not going to auscultate.
Also,
okay? Listen. The other thing I will ask you to do when you're on the face is your cervical lymph nodes, okay? So we've got 6 of them. You've got your preauricular, right? So right in front of your ears. Your postauricular, right behind your ears. Down at the back is your occipits. And then kind of right when your jaw makes that turn, those are your tonsillar. about midway down your mandible or your mandibular. And right here at the tip is your submental. Okay? Mandibular? So your preauricular, post-auricular, your occiput, tonsillar, submandibular, and submental. Okay? Those are not on your checklist, but those will be required. All right. So now onto the ears. Like I told you guys, this is the longest one you'll ever have. After this, it'll be easy. That one's bigger. Sorry, kiddo.
Yeah, I know.
So we're going to use the otoscope. You're going to make sure you put a speculum on it. Now, I know you don't have one of these at home. So, just basically fix some work on the outsides. So I'm just going to inspect them, look at them. Don't see any drainage, any crusties, any lesions. Already palpated, but I'm going to do it again. Any pain or tenderness?
No.
Any pain or tenderness?
No.
Oh, that's fun.
The eye contact is phenomenal.
I know some of your students are going to be like, are they holding a gun to her head?
No.
Yeah, I am.
No,
What?
you're not.
Yeah.
No, don't say
That's
that.
gotta-
Okay, this is class after all, y'all.
Sorry.
All right, so we are going to do something called a whispered voice test. So I'm going to stand behind you.
Okay.
I'm going to try to stand behind you. Let's put it that way. I'm going to try to stand behind you, and I'm going to whisper 2 words. Usually I like to use like a fruit and a sport, or 2 fruits, 2 sports, whatever you can remember. A lot of students too will also do whatever they can see.
Strawberry basketball.
I haven't missed anything.
That's what it was last time.
Of course it was. All right, so I'm going to try. I would try to get about arm's distance behind her, but I don't have the space. So I'm going to sit as far back behind, and I'm going to whisper 2 words.
Watermelon soccer.
Okay. Oh, you know what I forgot to ask you to do? Will you cover this ear for me? And yeah, that works. All right, now I'm going to test the other side. So we're going to do
Grape basketball.
yes, very good.
And you want me to do the other ear? Or?
No.
Okay.
My favorite
So, but you
sport.
will want to make sure that they cover an ear when you do this situation. Now, here's some fun things. I don't have a tuning fork on me, okay? So we're just going to use a real fork for these next 2 tests, but these are with a tuning fork, okay? It's the smaller tuning fork that doesn't have the little circles at the ends. What?
It's a big Y. A tuning fork.
Yeah, well, more of a U than a Y.
It's got a stick.
Well, I guess that's true. Anyway, you want to hold it with the bottom, with the little stem on it, okay? And what you will do is you will take your fingers. Oh, that actually worked. That was pretty awesome. But you'll pinch it, okay? Yes, it will hurt. You'll have to get practice with it. We'll get in the lab. We'll practice, I promise, okay? So hold it on the stem. Make it ring. Place it on the middle of their head. Do you hear it equally on both sides?
Yeah, I do.
They need to hear it equally on both sides. It's more the feeling of vibration than anything else. So they should hear it equally. That is called the Weber test. Okay? Are you trying to remember this now?
No.
So then we have the Rhine test, okay? Same tuning fork. You're going to hold it by the stem. Now this is where it gets a little awkward trying to move it around, but it is what it is. Will you sit sideways for this one, please? Thank you. All right. So I'm going to take it. I'm going to break it. I'm going to pinch it. I'm going to put it on her mastoid bone back here, right? And I'm going to ask her to tell me when she can no longer hear it, okay? Because it doesn't actually work this way, we're just going to talk through this, okay? When she says she no longer can hear it, I'm going to flip it and say, tell me when you can no longer hear it. Whatever the amount of time is back here, so say this was 5 seconds, right? When I do this, it needs to be at least 10 seconds, okay? So it needs to be double, because you're listening to air conduction when it's here. You're listening to bone conduction when it's here, okay? And then I would do the same thing on the other side. I will help you with this when we are in lab, so don't stress too much about it right now.
Do you want me to turn back?
Yeah. So now we're going to go to, this is not on your checklist. Oh, wait, I already have one. We're going to talk about how to hold the otoscope. Did I blind you?
You did.
I apologize. Probably blinded all of them too. Kind of hold it like a pencil, okay? Your middle finger or a K. guess is another way to put that. So I kind of hold it really close, okay, to the top of the, I don't even know what you call this.
Handle?
We call it sure, that works, barrel, whatever. But see how it's kind of like, you know, the pencil is on your middle finger and then you hold it with 2 other fingers, right? So I'm going to hold it like this so that I can put my pinky out and therefore be able to brace my pinky on him. And that way if she jumps, I'll be with her and not into her ear either farther to cause damage. You okay?
Yeah, you know what happens when I Otis too.
Well, I won't do it too much. So I'm going to stick it in her ear canal. Ooh. And I'm going to look in. I should be able to see
Yeah, I know.
her tympanic membrane that should be pearly gray. She's got a lot of cerumen in there right now, so earwax.
Okay.
I've
I've been telling you to have earwax for months.
Yeah, I know. Can I look at your other side?
That was the bad way to do that, but oh well.
Same thing. You have to switch hands when you switch ears. It's gonna feel awkward, but I promise with practice it'll make it feel much better. Again, slightly in. Ooh, this is kind of gross. Same thing. Looking for that tympanic membrane. On both sides should be pearly gray. Should see a cone of light. Otherwise, everything should look good. All right, now we're on to the eyeballs. I'm gonna look at her external.
I see it's about.
Yes.
baby.
I'm gonna look at her eyelids. There's no redness. They don't look inflamed. Her eyebrows, her eyelashes, everything looks symmetrical, evenly distributed. I'm gonna look at her cornea and her sclera. Will you look up for me? I'm gonna pull down her eyes. Everything looks nice and clear there. We're not going to inspect the lacrimal duct. Again, we've kind of already looked at the palpable fissures. I don't see any involuntary eye movement.
Oh, did you need the penalty box?
Eventually.
We're going to do a quick eye test for visual acuity.
Uh-huh.
Will you hold this about arm's distance out from you? All right. I want you to read. Well, here, put your glasses on.
Oh yeah.
That might help.
No, I can still see everything mostly.
All right. Cover one eye for me. Tell me the lowest eye and you can read.
LTFPH.
All right. Cover the other eye. Read it to me backwards.
HPFTL.
Okay. Both eyes.
How do you want me to read it?
From the inside out.
Normally.
LTFPH.
Awesome. Thank you. We have little Rosenbaums like that in the lab that you can use, as opposed to the Snellen, which is the further away one. We won't look at color blindness because I don't have the Ishihara plates.
I'm not colorblind.
I know you're not.
I was there for a while.
The one thing I don't have right now is the central vision testing, but we'll talk about that in class, so don't stress about it, okay? I don't think it's on your test. I hate the confrontation test because it looks for peripheral vision, which means peripheral vision has to be good to be able to even do that test properly. All right, now I'm going to do the 6 cardinal positions of gaze. Will you look at my finger and follow it with just your eyes and without moving your head? Excellent. You want to do it either in H like I just did or in a star. And you're really watching to make sure that those eyeballs aren't going like this as you do it. Okay? Do it slowly as well, because if you do it too fast, they're going to be like, where am I going with it? All right. And then I'm going to have you look at my finger again. Look at the wall behind me. Look back at my finger.
Oh, that's
Look at the wall
weird.
before me.
Oh, that's weird.
All right. And then follow my finger. Excellent.
That was weird. Her eyes like separated.
Yeah. It's convergence and accommodation.
That's why cyclopses don't have good depth perception.
All right, when you get to the eyes, you're going to change it to the ophthalmoscope.
Ooh.
If I get mine on.
Yeah.
Cool. Lights on. All right. So this can be done with your pen light or with the ophthalmoscope. You take your glasses off. I don't want to worry with those. All right. So there's a couple ways you can do it. You can do it just with flashing this in their eyes, or you can put a hand here so you can look at both. So I'm going to pull it in once. I'm going to watch the pupil constrict. I'm going to pull it in again and watch the other one constrict. Okay? Same thing on the other side. Watch that pupil constrict. Okay? So 2 times on each eye. Therefore, I'm looking for perla. So pupils that are equal, round, reactive to light, and accommodation. Okay? So we've done all of that. I didn't say you did do drugs.
You're right. Yeah, well, no, never mind.
The other thing I'll ask you to do is we're going to look through the hole on the ophthalmoscope, and I'm going to look for a red reflex, okay? So I usually like to put, here, I'll go on this side since you can see better. I like to put the light on their face so that I know where it's at. Look in, bring it in. You should see a red, yellow, or orange, basically in the pupil, okay? You know how when you take a picture and you have red eyes? That's what you're getting. There's that red reflex of their eyes within their pupil. So that is basically your first assessment, okay? Watch this a couple times. Read through the checklist. I think that should answer all the questions you have for your test on Thursday. But practice on other people. Like I said, we'll get in the lab. If you want to stop by when we get back into school, we can play around with taking more, with working with the equipment. Okay? Let me know if you guys have any questions. Otherwise, I will see you when we're back in school. Bye.